We're going to be demonstrating today how to insert a Foley catheter. The very first thing that you want to do is check your physician's order. You have to have a physician's order for a Foley catheter insertion. I'm going to demonstrate on the female, then I'm going to show the other things that you would include with a male catheterization. So the very first thing that you want to do when you go, you check your physician's orders, you're going to wash your hands, and you are going to identify your patient by two means. You're going to identify, this is Mrs. Williams. I'm going to ask her to tell me her date of birth, and then I'm going to physically check her armband to make sure that her armband has her name, Miss Williams, and her date of birth. The other thing that I want to do is make sure that my bed is up waist high so that I will not have to lean over and risk contaminating anything when I'm doing the catheterization. So now I'm going to position my client. I explain the procedure. Miss Williams, we're going to insert a Foley catheter, and if it's okay, I'm going to position you so for that catheterization. So we're going to position her legs so that I can visibly make sure that I can get the catheter in. You're going to need two biohazard bags. You place them, you make a cup so that you don't contaminate, and place them at the end of the bed. I'm going to wash my hands. I'm going to put on non-sterile gloves, and I'm going to perform peri-care to make sure that the area is as clean as possible. And you put on non-sterile gloves, and I have a bath rag and a towel, and I'm going to clean from the distal. I'm going to change the rag proximal, and the middle. I'm going to bring this out, and then I'm going to dry the area. I'm going to remove these gloves. Now I'm ready for my procedure. You're going to take a Foley catheter tray. It comes in a plastic sleeve. Now, one of the things that's extremely important is that you keep your patient in view, as well as your tray. Once you open up your tray should always, it comes with a triangle. It's folded so that you have a triangle. You want the first, what I call the flap, to go away from you so that you don't risk contaminating anything. You have two inner flaps. They come out this way, and then the last flap comes back towards you. You always consider the excuse me, 1 inch margin is considered contaminated, so you don't want anything to go in that margin. I'm going to get my gloves, and I just take 2 fingers, bring them over to the side, and I'm going to open up my gloves. Okay, once you have your gloves on, you want to make sure that your gloves stay at your waist. Do not drop your gloves below your waist, or that is considered contaminated. Now we're going to get our tray ready. You have 2 drapes in your tray. The very first drape is what we call a fenestrated drape. It's a drape that basically has a hole in the middle. We use that for the male patient. I'm not going to need it for this patient, so I'm going to discard it. The next drape has a water soluble background, and so I want the water soluble background to go against the bed. You also want to be careful not to cross over, so you want to take your drape and hold it so that you don't cross over it. So hold it out like this. Then you want to get the rest of your tray ready. You've got swabs that you want to open. You want to prepare them so that you can get to them very easily. I'm not going to need this. I'm not going to need this. This is water, and this is lubricant. Now I'm finished with this, so I'm going to discard. Your catheter has a sheath or a piece of plastic on it. That's going to need to come off, and you're going to need to be really careful taking that off so that you don't contaminate your catheter. I'm going to attach my water. And I've got my lubricant. Now for a female, we're going to lubricate about 1 to 2 inches. So you can either go ahead and lubricate the catheter, or you can put some lubricant in the box so that when you get ready, you can lubricate the catheter, however you wish to do that. Now we are ready to move to the bed. Okay, when you go to catheterize, you're going to commit a hand. Once you put that hand down, you cannot move that hand. And I'm right-handed, so I do everything with my right hand. So I'm going to commit my left hand. You're going to move the labia out, and I'm going to take my swab stick. You're going to do your distal first, and so when you come down, you're going to come down distal and come out and around, because you don't want to cross over your sterile field. Proximal, come down, and the last one is in the middle. Now I'm ready to get my catheter. I'm going to put it in my lubricant. I had put a little bit of lubricant in the box. You can either put it on the catheter or you can put it in the box. Now I'm going to ask my client to take a deep breath. It's very important when you put in a catheter that you keep your fingers back somewhat, because you don't want your fingers to contaminate as you go in with the catheter. So I bring my fingers back just slightly. I'm going to open up the labia. I'm going to move the catheter in, and I'm going to move my fingers back. You're going to go in until you see urine. Okay, I see urine. So what I'm going to do with these 2 fingers up here is I'm going to gently hold the catheter while I put water into the catheter. Okay, I'm going to gently pull back to make sure my catheter catches. Okay, and it caught. So now what I'm going to do is I'm going to take my syringe off. I'm going to keep my catheter pinched. Now I need to move my catheter bag across to the bed rail. But you need to make sure that you don't get a backflow of urine. So you want to make sure that your catheter stays pinched while you move your catheter bag across the leg. Now I can turn loose on my catheter and the sterile part is now over. And I'm going to make sure that my catheter's got enough leeway so it does not pull. Now my sterile part is over. I'm going to keep my gloves on because I may have some contaminant in this area right here. So this goes in the trash biohazard bag. I'm going to, if my gloves are not contaminated, at this point I can reposition my client. Okay, I'm going to go ahead and I'm going to take these gloves off and I'm going to put on some non-sterile gloves. I'm going to wash my hands and I'm going to put on some non-sterile gloves and I'm going to get rid of my rest of my come up under the cup. You're going to tie your bag. I'm going to wash my hands one more time. I'm going to, now I'm ready to come out of the room. I'm going to put my patient in low position, bring the bed down. I'm going to make sure the side rails are up. I'm going to make sure the call light is within reach. And I am going to ask my client how she's doing, if she needs anything. And at this point, I'm going to be ready to come out of the room and I'm going to document my findings and I'm going to report any abnormalities.